Hi everyone, welcome to day 5 of Heart Attack Week. Today we will be discussing the treatments given for heart attack. That is during heart attack and after heart attack, including hospital management and home care. When a person is getting a heart attack, they can use medication like aspirin. A person when unconscious after heart attack and a rescuer is available nearby, they can start CPR immediately within 2 to 3 minutes. It is an emergency procedure that can be done when patient goes unconscious without breathing during a heart attack. If 2 rescuers are available, it is better. The benefits of 2 rescuers are, it will reduce the time lag in between the compressions and also it will reduce the stress level of the rescuer. When starting CPR, we have to call for emergency and immediately after CPR, we have to take the person to hospital. Before starting a CPR, we have to check whether there is any kind of outer bleeding in the patient. If there is any kind of outer bleeding due to hit or fall, we have to first manage bleeding. We can see the difference between adult CPR and infant CPR. In adult CPR, we have to first check the conscious level of the person. In adult CPR, it is better to place the person in a flat surface. After placing the person on a flat surface, the rescuer can kneel down on the opposite side. Tap on the person's arms and call out their name loudly. If the person is not responding and not breathing or only gasping, you can check their carotid pulse. Carotid pulse is present, you can start CPR immediately. It is an emergency procedure which is done with 30 compressions to 2 breaths. Place the hand over the lower half of the breastbone. By placing the hands over the chest and the fingers are interlocked, the elbow should be also locked and the shoulder should be over the hands. Put one heel of the hand over the other and interlock the fingers. Provide 30 compressions to 2 breaths. Whenever you are giving compressions, in each compression, the chest should come back to the normal position. You can press 2 inches down. While giving breaths, first of all, open the airway to a neutral position. It is by a technique of head tilt and chin lift. Give a breath, the person's mouth should be completely sealed. Also, allow the person's chest to rise and come down before next breath. In infant CPR, you can use either a thumb or 2 fingers. For this also, keep the baby on a flat surface. You can kneel down on the opposite side. Take an imaginary line in between the nipples and place the hand below this imaginary line. If only one rescuer available, they can give 30 compressions to 2 breaths. There are 2 rescuers, we can use 15 compressions to 2 breaths. Press down 1 to 1.5 inches down. They can use either a mask or mouth-to-mouth technique for breaths. Research shows that greater than 20 to 30 minutes of provision of CPR has a greater survival rate. It is better to take to hospital as soon as possible after CPR. What are the hospital managements for heart attack? They can use drugs like antiplatelets, anticoagulants, cholesterol-lowering medications, antihypertensives, beta blockers or combined alpha and beta blocker, calcium channel blockers, angiotensin II receptor blockers. If already CPR has provided before reaching the hospital, they might be giving aspirin. Also, they can include the treatments like angioplasty, bypass surgery, artificial heart valve surgery, minimally invasive heart surgery, radiofrequency ablation, cardiomyoplasty, heart transplant, etc. Home care include a proper intake of medications, maintaining a proper diet and also maintaining mild exercises. Hope this video is helpful for you. For more useful and informational videos, subscribe and support. Thank you.